that was a real concern because we had no idea what would be going on in the island. So there were some difficult conversations we were having with the UK over that.
Yeah.
Welcome to the Bailiwick Express podcast. My name is Matthew Leach. I'll be joined each week by the editor of the Express, Aaron Carpenter, for a series of podcasts. Each will shine a light on topics from across the Bailiwick. The format will change week to week. We'll have debates, reviews, hot seat interviews and plenty of guests. So stick with us as we offer some insight on the most important issues we in the Bailiwick face. It has been a year like no other, and to review it we needed the help of two of the most important people in the Bailiwick. We're lucky enough to be joined on this podcast by the Director of Public Health, Dr. Nicola Brink, and Deputy Heidi Soulsby, who was President of HSC when all this kicked off, and now advises the Civil Contingencies Authority, both very well recognised. Now we know the stats, we know where we are. We took this opportunity to talk to them both on a more personal level.
First of all, going back in time to the professor at the Cape Town Hospital who actually supported you on this journey into public health, into virology, which, as I understand at the time, was still quite a developing area of medicine.
Yes. So the unsung hero was the first person that had a profound professional impact on my life, and that was Professor John Moody. And it was at the time when I was working as a junior doctor doing haematology, and I was concerned about viral infections really contributing severely to disease and death in bone marrow transplants. And I went to discuss the management of viral infections with him. And I remember him saying to me, "You're clearly really passionate about this subject. Come and join us." And I thought about it and I thought, yes, this is where I want to be. So he really did put me on the right course. And during my time as a junior doctor specializing in virology, he had a profound effect on my career and really helped me progress forwards.
Reflect, if you can, on your career journey to date.
So it actually went via London, my career journey. So whilst I was still training, still specializing in South Africa in virology, I went to the International Virology Conference in Berlin. It was just after the Berlin Wall came down, so it was a very historic time in the whole history of the world. And during that time, I presented a paper on the mapping of the HIV epidemic in South Africa, and I was really interested in looking at HIV in the African context. And Professor Tedder came and spoke to me afterwards. Now, Professor Tedder was the head of Department of Virology at the University College London and University College Hospitals. And we had a discussion and he suggested that I should come and work with them for a while in the UK. And I was really interested in broadening my career, looking at how other jurisdictions work. So I went across to University College Hospital, initially as a senior registrar, which was part of the old junior doctor function. But I was fortunate enough that they were able to create a consultant and senior lecturer post. And I spent many very happy years working at University College, looking at opportunistic viral infections, working with HIV, working with bone marrow transplant patients. And I found it incredibly rewarding. But I've also always wanted to balance my work life with the fact that I have two wonderful children. And when they were young in London, I just didn't feel that I was spending enough time with them. And it was a time that my husband was lucky enough to get a job in Guernsey. And we looked at Guernsey and we said, this is the most amazing place. We want to come to Guernsey and we want to bring up our family here. And at that stage, our son was 5 and our daughter was 6. And they've had the most wonderful childhood here. But I've also been incredibly fortunate to be able to carve a career out in Guernsey. And I'm so grateful for the opportunities that the island has given me.
And I guess you could have never have known what the island would be facing when you came over. I guess this is a question to pose to both of you. I mean, how much has this changed your life in the last year? And when did you know everything was about to change, when we were facing what was coming?
knowing Nikki and we've worked really closely in the time that I was at HSC, and really helped us bring on what we wanted to do in health. But knowing her, when she sent an email on the 14th of January to say we're worried about this virus in Wuhan, I thought there was something that told me that this wasn't going to go away. And it was a blur after that. For a long time, it was a blur of needing to call the Civil Contingencies Authority. And then it just feels like a blur of press briefings and just going through it. You tend to become get into a routine, even though it was totally out of your normal existence. And you just work through. You took every day as it came, and it's been the one area where this lockdown's been similar to the last one. It's been very different in many other ways, but it was just that every day not knowing where we were in terms of the number of cases, and are they going to go down, are we making a difference, and just feeling that was really, it's always been the hard bit, I think, and just hoping that we've managed to get on top of it.
I think it has been a very interesting journey. I can remember looking at those cases arise towards the end of 2019, early 2020, and looking at this, thinking this doesn't look good. This virus was not behaving in a way we'd seen before. You seem to have human transmissibility occurring. And we really felt, certainly from the middle end of January, that this had pandemic potential, which is why we felt that we had to prepare as such. We knew preparation was key for us as a small jurisdiction, so important.
Yeah, and I think the truth is there was never any panic anywhere. Public health, this is the information, we are concerned about it. Now we need to get on with it. And I think throughout all this, everybody's been very calm. I don't recall ever in any meeting, any discussion I've had, anybody getting heated about anything whatsoever. It's been, these are the facts, now how do we deal with them? And I think that's been really good. I really appreciate the professionalism that's been around.
And I think also we've been able to have that constructive challenge between the political and officer side, and it's really been that relationship that we've developed over time where we can challenge each other. We feel confident to challenge each other, but it's productive and it's looking for the best outcome always.
And those early concerns led to a fateful meeting ahead of the first lockdown, where Deputy Salisbury, you would have taken a vote to lock the island down. Can you speak about the weight that you felt when making that decision, and the massive difference it would make?
It was incredibly difficult. Not the decision itself was not difficult, because we knew it was the one thing that we had to do. It was understanding the implications on people's lives really hit me. Really did. I remember coming home from when we announced the lockdown at Beausejour, came home to my husband and I said, "Oh, I don't know what we've done. I hope we." It was just that feeling of, "Gosh, this is such a big thing that we're doing to the community." I didn't go into politics to restrict people's human rights. It's gone quite the opposite, and having to do that was very difficult. We knew we were doing the right thing, but the sheer height of what we had to do, it's really that was really difficult, and ever since it has been, and particularly this lockdown, it's been knowing that what people had to go through last time, and I think this time it's been much harder, and it's been fascinating to see how it's impacting people's psyches in a different way. And I'm sure there'll be loads of research papers and everything on this.
I know that's something that people recognise in you, Dr. Brink, is your calm demeanour at the press briefings, your soothing tones. Were there any times where you felt overwhelmed by the sheer enormity of what was happening?
Yes, I think there's certain times that I'd sit quietly in my office, particularly in the evening, and I'd reflect on the enormity of what was happening, that we didn't have the tools to cope with what was clearly a rapid doubling of infections. And also we'd now detected cases that were unrelated to travel. If you recall, all of the early cases were travel associated, or were through contacts of travellers. And this was the first unexplained community seeding. So we knew that the community was seeded and we had to respond. To me, there is one unsung hero, particularly for me in this time, and that's Mark Degare, who's my line manager. When I say he's been with us every step of the way, you couldn't have asked for a better person to go through this with.
Absolutely, he was very much a glue in all this. I feel, putting people together, making sure conversations were there. But you're right, Nikki. That was a really worrying time when we weren't getting the tests done, and when we thought that they were going to stop doing any of our tests because the UK decided it wasn't going to do community testing, and that's what we're reliant on. Yeah. That was a real concern because we had no idea what would be going on in the island. So there were some difficult conversations we were having with the UK over that. Yeah. But unfortunately, we got over it. But that's very worrying.
It was worrying, and it flew in the face of our strategy. So from the beginning, in February, we trained up our contact tracers, and we said we're going to have a community test, track and trace program. And that was our fundamental strategy. And so we knew we had to increase the testing capacity. And again, we had huge support politically, but also from the senior management team in the States of Guernsey to then develop an on-island testing capacity. So what we have now is a molecular capacity on the island that we never had before. And we can now test 1,500 to 2,000 samples a day compared to the 35 we had at the start of the first wave. And that's something I think the island needs to be incredibly proud of, because it's no one person that's done it. It's everyone working together that's done it.
Yeah, you're right, Nikki, there. It was such a relief when we saw the equipment arrive. I can't tell you, we were so pleased. And then we built it up over the coming months, didn't we? So one of the last things I think I did when I was in HSC was to get the policy, to get the letter through so we could get we could extend the testing capacity, which is really good for us this time around.
What we were doing in the community was aligning with what the acute services under Dr. Raby and Dermot Mullen, Lane Burgess were doing in the hospital. So it wasn't a barrier of this is my job, this is your job. It was this is our job, and let's work together across the whole pathway rather than trying to divide it into little pieces.
And what has it been like managing the workload of it as well? And as a modern day politician as well, you're not just getting calls, you're not just getting messages and emails from people. You also have people tagging you into social media posts saying, what's this about? Can you explain this? The days must have been incredibly long, and it must have been difficult to switch off.
It was very important. The early days of the last one and this one is making sure that people didn't get carried away in misinformation that could cause a problem. So I was quite heavily involved in that, and we had thousands of people asking questions that we were having to manage all the time. So it was. Yes, COVID was about the thing that I was always talking about, but at the same time we were trying to keep the everyday, the not BAU going at the same time, because government doesn't stop and debate doesn't stop.
You mentioned social media there. I mean, social media and the digitisation of our lives has been a big part of this year-long experience. Have you felt the pros and cons of Facebook and Twitter and rumours and getting messages out there? Have they weighed each other up, or has it been a...
I think it's been, in many ways, it's been really useful. Because in some ways it's not, in some ways it is. In some ways you can give out information there and then. As I say, you've got people who say something, saying, "Oh no, you're wrong." And sometimes when I'm not in the briefings, I look at the comments down the side, and I have to say, "No, that's wrong," and don't worry about it. So I get that. So from that point of view, it's good. But it's a lot. I mean, there's a lot of stuff on there. You can't pick everything out. Early days, right from the beginning, it was important to have the head of this who was basically running this was Dr. Brink up there front and centre, so people could, and a face people could feel they could trust. It's different as a politician. People think, well, what are you doing? And there'll always be a question about the politician, but having somebody who has not got that baggage around her, and who could speak with authority and all about the science behind it, and help educate the community because the more you're informed, the more you feel that you can deal with the subject at hand and understand what's going on. It's when you don't know and you've got no information that people start to really worry. So early days, it was all about being open and honest with the community, telling them when we got it wrong, which we did, because we said very upfront we would never get it all right, because we were making it up as we went along. I mean that makes it sound like we were picking things out the air. We weren't. We were using judgment and evidence all the time, but we didn't have a book to follow to say this is what you need to do with COVID-19, and that was very much it's being getting Nikki front and centre of it was the best thing to do, and now she's the same clearly.
I don't think that, but I do think also you have a duty to communicate that information. I think it's part of your duty to the population.
I think it highlights the heightened interest with people in Guernsey, because you probably can't go to the supermarket anymore and not be Dr. Nicola Brink or Deputy Heidi Soulsby. And in such a small community, I was wondering how that has impacted you.
I think from my perspective, it's been enormously positive, because we really have had a wall of support behind us. And when you're sitting working late at night and you feel that community support, it honestly makes a fundamental difference. Most people just want to say hello. Children want to say hello. I think developing a relationship with children, a mum, but also having that relationship with children, I think it's been of fundamental importance, because I think we owe children the dignity and courtesy of explaining what we're doing as well. So being prepared to, yes, have a conversation with a child about what's happening, I think is really important, as it is important to have a conversation with an 80, 90-year-old. So that communication has been really important. But I think also you need to embrace the community as a whole. And if people want to stop and have a chat when I'm out, I welcome it. I think it's great. And I think it's that support that has helped us get to where we are. And I think we need to embrace it and celebrate it, because I think it's been absolutely amazing.
Yeah, I've been humbled by the reaction I've got. you're used to being sometimes collared in Waitrose for some decision you've made in other bits of the States, but it's been just people just coming up to you and saying thank you. It's really humbling. It really is. It's great. It did bring the community together, and I think that's been fantastic. I think the second time round has been so much harder though, for all of us.
Yes.
It's just thinking, we're going to have to go through it again, but the way we've been able to get out of it has been so much faster than last time. It's because of the work that's been going on behind the scenes, so we can gear up, get the testing done, and so we learn from last time, and hopefully get through it, and we don't have to do it again. And that's obviously what we're trying to work on now.
And what we did this time, for the first time, we didn't use it in the first wave because we didn't have the capacities. We did surge testing, so we'd identify an area of interest for us. So it might not have been a direct, well, I've got a case and the contact is X. It'll be, I've got a case, and they might have a 2 or 3 removed link with a specific area, but then there's someone else with a 2 or 3 links. So then we'd put surge testing around that area. So we used our testing capacity to then find asymptomatic cases, and that's been a game changer for us, as our enhanced testing capacity, because it's enabled us to get on top of this wave despite it being caused by a more infectious variant. That, together with our testing capacity, together with our vaccination program, have been game changers in the second wave.
Yes, because you can react in real time, can't you? You're not facing a 2 or 3 day delay every time.
No, if we're worried about a case and we think that there's particularly a case in a critical area, we've got 2 types of tests we can do now as well, which probably isn't as well known. We've got 2 types of PCR tests, one of which is a very rapid test, which we use in defined circumstances, but we can have that result available in an hour if we need to. Now, it's not fit for large-scale large-scale processing, so you can't do 200-300. But if we have particular cases we're worried about, we can test, have a result in an hour, and then, if necessary, put in contact tracers behind that. And the contact tracers, we were getting runs off at 8 in the evening, and they would start on the runs at 8 in the evening and be working till 12-1 in the morning during this wave. So that dedication of people just to really push themselves and work incredibly hard was also of fundamental importance in this wave.
And it showed us the difference between this virus and the last one. Was certainly last time everything went into lockdown and Zoom, so many cases just went down. We had a few, but then we really saw it go down. This time we saw it go down, but then there was a couple of bumps in the mat, and it's fascinating just how this virus has spread differently. And that was a concern back then. We said, why isn't it just doing what it did last time? It made it very clear that we had a different virus.
I think this has been fantastic. I mean, I'm going to have to start to draw it to a close soon, but I guess one of the final questions to put to two of the experts we have in Guernsey is about the future. I mean, are we going to be living with this? What is the landscape going to be 2, 3, 4, 5 years down the line?
So I do think that we're going to have to move from a pandemic to an endemic situation. So a pandemic is when you've got global spread of a virus, to an endemic situation where you have pockets of infection. So I think you will see the transition from a pandemic to an endemic situation. That will then be associated with the increased vaccination, the protection against the original SARS virus, and hopefully a lot of the variants. Looking forward into the future, I think what we'll do is we'll be focusing on the so-called variant of concern. The variants of concern that I'm particularly interested in are those with reduced vaccine sensitivity. And what you may then have is some sort of vaccine boosting program. The vaccines tweaked slightly to allow for more vaccine-resistant strains to be covered as well. So I think moving from a pandemic to an endemic, increasing vaccinated population, and a focus on variants of concern rather than all cases of SARS-CoV-2, the virus that causes COVID-19, is how I would see things moving forward. And with that, I think you'll see things like vaccine passports being introduced. You'll see things like possibly some testing in various areas as well. So that's how I see the future.
I agree with absolutely everything Dr. Brink said there. I would speak from a political point of view. We've really got to focus on recovery now. The COVID has really impacted our community, and we need to get on the road of getting out of all the problems it has caused and onto the road of recovery. So that's why I have spent a lot of time on the government work plan over the last few months, because I've seen it as the springboard for Guernsey to really punch above its weight in the way I think the community did last year over COVID. And for me, that's what I want to see happen, and people getting behind recovery.
I think that's a brilliant moment to finish and tie it all up. Thank you so much for your time, and I'm sure the public will want us to say thank you as well. And thank you very much for getting involved.
Well, thank you for having us.
Thank you. Thank you very much.
Thank you for listening to the Bailiwick Express podcast. The title track was Shift My Weight by Luno. If you enjoyed it, I know it's a pain, but please like and share. It all helps, and remember, you can hit bailiwickexpress.com to stay right up to date with whatever is happening in the Bailiwick. You can find us online, on social, on email, and on internet radio. There'll be more from me, Matthew Leach, and all the Bailiwick Express team next Friday.